Mr. Speaker. Mr. Speaker, I rise to ask question 135 of 2025, and the question is directed to the Minister for Health and Medical Services. Can the Minister inform Parliament on the retention incentives the Ministry has in place for the following specific categories of health professionals, excluding nurses: medical officers, dental officers, medical laboratory scientists, medical imaging technologists, radiologists, and pharmacists? Thank you, sir.
Thank you. I now call on the Minister for Health and Medical Services, the Honourable Dr. Ratu Antonio Lalmalam.
Thank you, Mr. Speaker, sir, and I thank the Honourable Member for his question. Honourable Speaker, sir, the Ministry of Health and Medical Services continues to ensure its commitment in executing one of its key strategic outcomes, which is to attract, select, recruit, retain and empower the right people to create a diverse and inclusive and engaged workforce. Mr. Speaker, so in the last 2 years, much focus was on the effort to retain and reduce the rapid attrition of nurses, which occurred in 2021, 2022, and this has been successfully achieved given the enormous reduction in the number of nursing leaving the ministry. The ministry is also trying its best to ensure that other health professionals is given the best working conditions and incentives within the ambience of the law. There was also measures introduced by government earlier for job security purpose, and this includes increasing retirement age, salary increases for the last 2 financial years, recruitment of retired workers for scarce skill areas, opportunities for training and capacity building locally and abroad, collaboration with partners for overseas short work attachments and seminars. At the Ministry of Health and Medical Services, our medical staff who serve in the rural and maritime areas and occupy staff quarters do not pay rent. Honourable Speaker, so even though there is no specific retention monetary incentive in place for most of the cadres, the following existing strategies are implemented for retention and recognition purposes. Medical officers, separate salary structure, which has the base salary start from step 4 to step 7, and in addition to their salary, a medical on-call allowance, called MOC allowances, is paid depending on the health facility a medical officer is serving in. Medical officers who are serving in the rural and remote areas are eligible for rural and remote allowance, which classified into merit and single entitlement. Medical laboratory scientists, all medical laboratory scientists are recruited at remuneration of Band 4, Step F, Band F, Step 4. Significant improvement in workforce retention found given the current field medical laboratory scientist positions of 96% that cushion the current demand of laboratory services in all health facilities. Dental officers, they are paid with on-call allowance wherever the officer is attending on on-call duties. The ministry is facing difficulties in recruiting dental hygienists position due to lack of interested applicants, as the training institution no longer offers specific diploma program, but are offering degree for oral health instead. This is probably why many choose to take up dental therapist, as it has a higher band grade than a dental hygienist. The ministry is currently still in the process of working with the development of the National Strategic Plan for our health workforce 2025-2034, and our technical working group has been having meetings on a monthly basis. So this plan is to guide the ministry with the required need of human resources in all health professionals for the next 10 years, in alignment to the demand of the services and international standards. As for medical imaging technologists and pharmacists, positions are areas that the ministry is still facing difficulties in attracting qualified applicants. Due to no interested applicants, as graduates opt to take a better offer from other organizations. Strategies of salary adjustment within the eligible salary range were not approved. But the ministry will continue to work on other retention strategies that can attract these cadre workers. Honourable Speaker, sir, the Ministry is also working on re-evaluating allied health professionals such as environmental health, medical imaging technologists and pharmacists, where necessary to accommodate additional responsibilities to grow in service demand and emerging need. The Ministry has encouraged that some measures that the government and Ministry has put in place are working. We are seeing a slowing down of staff attrition rate from the Ministry. We may not be able to match salaries of remunerations in the private sector or abroad, but we can make their working conditions attractive enough for those who have the passion and commitment to stay and serve the Ministry and the nation. And I thank you, Honourable Speaker.
I thank the Minister, the Honourable Dr. Ratu Antonio Lambalabu, for his answer. I invite supplementary questions, if any. Honourable Maharaj, I recognize.
Thank you, Honourable Speaker. And Honourable Speaker, I thank the Minister for Health for that comprehensive answer. But unfortunately, that does not resolve the issue that we are currently facing. If you look at Ministry of Health, we don't have director levels or senior managers. Most of the department heads are sitting at principal positions. The issue is going up the hierarchy. We need to create more positions such as managers and directors who needs to be sitting in these divisional hospitals. So are there any plans to create director level position and manager level position within this cadre so that individuals or these allied health workers can actually transform themselves from senior technicians to these levels before actually being promoted to the principal level? Because if we see, there's a generational gap. If you look at the principal level position, there's a person sitting above age of 50, but the whole workforce is between the age of 20 and 30. In between, everybody has migrated. So as Minister, looking to introduce these more positions that can actually give career pathways to allied health workers? Thank you.
Thank you. As Minister.
Yes, thank you, Honourable Speaker, and I thank the Honourable Member for his statement. Nevertheless, yes, I had mentioned that we're currently in the development of the National Strategic Plan for the Health Workforce, 2025 to 2034, and that will guide us into some of the recommendations that you have mentioned that we're already working on it, and that is realigning some of the positions to, say, as the director level, as you rightly mentioned, to allow kind of incentives for staff to stay on board to ensure that they have a pathway to go to right up to the PS level. No.
Thank you. Honourable Rinesh Sharma.
Thank you, Honourable Speaker. Thank you, Honourable Minister. This question was apparently sent to me to ask the Minister for Health. You've spoken about recruitment and pay. This question is in regards to medical laboratory scientists in our workforce that have not received overtime, and while they're at the salary band of other people like in the pharmacy and in the radiology department, the medical laboratory scientists are not getting the overtime, and they're being told that things like there's no funds or budget is less or something like that, which doesn't sound good or reflect good on the government. So if the Minister can provide clarity on this.
Thank you, Honourable Member. Minister.
So, thank you, Honourable Speaker. Overtimes are being paid, and if they are not being paid, that can be brought to my attention.